Hello, this is Dr. Lewerenz, the Longevity Health Institute. Hope you're well. Just finished up my afternoon here at Longevity in Rochester Hills, which, by the way, we have opened our new location in Bingham Farms, right on the border of Bloomfield, 14 Mile in Telegraph. Happy to see you, taking new patients as always. Me and my practitioners, I'm there a few days a week, just like out here in Rochester. But we are open finally. Took a long time, took several months, but two locations for you, and always accepting new patients, just so you know, to bring you the best and personalized, functional regenerative medicine. Just good medicine, good care. That's important nowadays, isn't it? I want to share with you some new things, some new studies, some new thoughts I have, some input into some things. One thing that is really important to me, and I kind of don't talk about this, and I have several books on my shelves and stuff like this, but I want to share this with you. This book by Jenny Allen, Get Out of Your Head, is such a good book, by the way. I really value this book, and it's really based on what we discuss with ourselves between our ears. So if you're really looking to grow and you're really looking to evolve, and how should I say this, take it to the next level. Of course, we have our 6-point model where we're addressing hormones and things that affect your immune system and energy and mind state and brain state and neurotransmitters and gut health and diet and how you detoxify and all these things that are so important in the foundation of your health. But what happens between your ears and what you think and the conversations you're having in your head really can make and break your life. Everybody's perspective matters. Everybody's truth is their truth and what they live. But what I really like about this is how the toxic, if you will, thoughts, and how important it is to address those and really put the brakes on those, and how this book really addresses. And I try to mentor and coach my patients on this. I'm not a psychologist. I'm not an expert in this at all, but I want to share with you the importance of that, because it is part of our 6-point model about the mind-body connection, stressors, psychological things, childhood experiences. There's another great book, by the way, partially written with Oprah Winfrey, I believe a Dr. Harris, an MD, about what happened to you. And that book is a national bestseller, New York Times bestseller also. And it's great about how once we recognize negative, toxic thoughts, maybe experiences, and get over traumas, how many things like energy and pain and immunity, I'm going to tell you a story here in a second, immunity can hugely improve. So, here in this pandemic still that we're dealing with, and all these people that we see unfortunately daily doing telemed besides our regular functional, personalized medicine approach we do, and doing the best that we can possibly for you, giving you the best guidance and care, and dealing with COVID. I will tell you 100%, there's two major features in, let's just call it your COVID protocol. We have a COVID protocol. You can find it on our website. We can email, or we find it, follow us on Facebook. I address this all the time. But two of the main things that I see when patients of ours get hit so bad are a little bit, I hate to say this, but a little bit exactly what this book is about, okay? And that is stress and the stories sometimes. I have somebody currently right now that is dealing with, and she's fairly young and fairly healthy, and I say fairly because there's some things, you're only healthy as your weakest system, and her weakest system has been her adrenals, and stress and things that are affecting her adrenals because of a divorce and some battles with her children, her ex-husband in court, and all these things that are pulling. But when you're stressed, we tend to get negative. We tend to reflect on and kind of live these toxic thoughts and negativity in our head, and that absolutely affects your immune system negatively, like her COVID hitting her harder than her fiance's, it wasn't as dramatic of effect, and we're having to be more aggressive with our treatments to keep her out of the hospital and keep her safe. And it's effective, but she definitely got hit harder due to stress and her mindset. Gut health is another big one. So if you said, hey, doc, how can I be immunely optimal besides taking zinc and C and D and, quercetin and, using silver, hydrosol, antiviral silver that we use here all the time. Most things are to make sure that your adrenals are good, that you're not overstressing, that you're not living negatively in your head, that you're trying to be positive and uplifting and looking towards, the lessons and benefits of even negativity and things that maybe have been wrong in your life and growing from them. Hey, growth is such a positive thing in so many ways. But the point here is it literally affects your immune system. I see it here day to day. So how do you optimize and be COVID, if you will, preventative? Be positive, have good adrenal support, sleep good, and eat good and have a good gut, because the other thing is your digestive system. 70-80% of your immune response, 100%, and I say that authentically, seeing it here for years, is your gut health, your digestive lining, okay? And I tell patients this all the time. There is a COVID-19 study says 27% higher deaths, okay, mortality, when people are on a PPI, which is like Prilosec, omeprazole, Prevacid, Nexium, all these PPIs for antacid effect in the gut. It's not the drug, it's the bad gut. The bad gut, the bad microbiome, the bad flora, the endotoxic reaction that affects your immune system at your gut lining creates a horrible immune response, and 27% of those people have a higher death rate. So remember, fix your gut, have a good diet, take good probiotics, good supplements. You can get them here, get them online, make sure you're getting GMP, etc. And fix the negativity between your ears. Okay, live positively, read positive things, hang and be with supportive people that are positive about things in your life, and whatever your, whatever your, I should say, agenda is, meaning whatever your goals are in life, whatever, you're important to you, live around supportive people for that, and that are positive, okay? Don't entertain negative thoughts and negative talk and anything that is putting you in that toxic space, because it will bring your immune system down, okay? I have a patient here, and why I'm telling you this story too, and something that's new, is we have used in her some things that are very effective for our autoimmune disease, and that is low-dose naltrexone. I have a whole video on LDN. You can watch it, and we use this very effectively. We work on gut health. We use supplements for digestive lining. We use peptides, etc. A lot of these things that can help your immune system and balance your immune system. But one of the things that we haven't really budged her, her ANA is always positive. She always has a speckled response ANA, and she has autoimmune disease, Hashimoto's, and lupus. And we've worked on her gut, and she's been gluten-free, and we're doing all these things and doing them with good intention, and she's working hard. And really, we haven't touched or lowered her antibodies or changed her helper cells or her immune cells and she's frustrated. Well, she came in this morning, and we had talked about and addressed stuff like that's in this book, but about the mind and body. And I recommended a counselor that she could get online through Zoom that is called BetterHelp. You can just look that up, betterhelp.com. And you get counselors and stuff that fit you, and it's kind of nice because you kind of interview them. But long story short, she got into a better mindset and a better positive place, and her Hashimoto antibodies have dropped dramatically, okay? And I believe it's because she's in a better mind state and less stress, meaning a more balanced immune response. We'll keep tracking those numbers. They're not perfect, and I actually think that we'll get her ANA down to pretty much, normal or not detectable negative. So I can't overstate the effects of the mind and body and that connection. Other thing I want to cover is this. Please, 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 if you have been exposed, or you're getting symptoms, or you suspect, or you are positive for COVID-19, whether you're vaccinated or not, okay, assume you're getting this micro thrombotic effect, i.e., meaning your blood's getting thicker, okay? And what does that do? Well, that everything in your body is affected by blood. So meaning your brain, your eyes, your kidneys, your heart, your liver, your adrenal glands, your ovaries, your testicles, you name it. We have seen insults due to thrombosis or blood thickening due to COVID-19 and due to the infection. So if you're sick, suspect being sick, tested positive or not, been exposed, but you have some kind of symptomology, I would highly recommend at least taking a baby aspirin so that it thins your blood a bit. If I had to estimate the amount of blood tests that we get here post-COVID, within 10 to 14 days post-COVID, okay, infections. And again, whether you're vaccinated or not, it makes no difference. This effect on your ACE2 receptor in your endothelium, in the vessel wall, all over your body, increases von Willebrand factor, increases fibrinogen. You develop a positive D dimer, which is a sign of blood thickening, okay? And you are getting this effect. That's exactly what the loss of taste and smell is the gray matter getting thrombotic hits to the olfactory system in your brain, and you lose taste and smell, okay? And that's just a common thing. So we see this, I would estimate about 50% of our patients post-COVID. And yes, we're seeing a lot of cases, and we have since the late summer, early fall, and we are doing our best to keep them out of the hospital, and mostly successfully, I'll tell you. But a lot of the side effects and the big hit and the long haul stuff is because of the thrombosis. So, at least, I'll tell you a few natural things you can do, but at least take a baby aspirin until you're told otherwise, or until you have no symptoms, or you see your doctor, you see us, or what have you. Post-COVID, I recommend all of my patients get a CBC, a fibrinogen, a D dimer, a vitamin D, a SED rate, and a CRP, and because that looks at a lot of the common things that are being affected with COVID, okay? Now, what can you do also naturally to improve your blood coagulation, meaning thin your blood a bit and etc., is you can take omega-3s. Good omega-3s will always thin your blood and keep you less thrombotic. Nattokinase, a natural blood thinner that's made from fermented soy, and curcumin, which is an extract from turmeric that also is very less coagulable and makes your blood thin. It's anti-inflammatory, wonderful for inflammation in the body, has immune effects and all that. But that is also really important. Now, also anything that can increase your glutathione pools, the strongest antioxidant in your body. And I recommend a lot of times people just adding when they're with COVID or during and post-COVID NAC, N-acetylcysteine or NAC, because that increases your glutathione pools. So, these are just things that have been in our practice lately and things I want to remind you of. Please share this video, because what are we helping? Well, we're helping your immunity. We're helping your mind state, which is your immune system. We're helping your gut health, and we're helping your blood to be less coagulable. So in this pandemic and in these, this hit of what we're seeing and these rates that are high, because the truth is, the facts of the rates are very high, and the virus is out there, and we're all going to probably eventually get it and eventually get some innate immunity, okay, which is the best, getting innate immunity. And the point being is, you want to stay protected and out of the hospital, and obviously progressing into a more severe case and damaging your body. So hopefully this makes sense and is enlightening and, motivating to take that part serious, because I think it's often overlooked, okay? And again, grab this book. I'm not getting paid to say this. Excellent, excellent book. This book is very, very, very simple to read, and great information, some spirituality in it, a little bit Christian based, which I love. But no matter what your spirituality is, the message here about between your ears and toxic thoughts and and words and things like this just bring us down and do nothing but make us sick and others. So be positive, be uplifting, love each other, and always do the right thing. This is Dr. Lewerenz. Be well.